UK Secretary of State for International Development, the Right Honorable Penny Mordaunt. I don't know whether she's still around. The Secretary of State for Health and Social Care, the Right Honorable Matt Hancock. Representatives from the Evening Standard newspaper, the Elton John Foundation, distinguished guests, ladies and gentlemen. It is my pleasure to join you here today at the candidate for this important forum that seeks to accelerate progress to stop HIV and create AIDS-free cities. Receive warm greetings from the people of the great city of Nairobi in Kenya. You are welcome to visit our country where we enjoy warm sunshine almost all year round, and the hospitality is unmatched anywhere else in the world. Kenya underwent a historical past like most other African nations that involved the scramble and partition of the continent followed by independence. Most African countries are 50 to 60 years old since independence and are still in the process of establishing governance structures. Kenya and the United Kingdom enjoy good bilateral relations on trade, investment, capacity building, technology transfer, tourism, and security. Nairobi started as an urban center in 1900 during the construction of the Kenya-Uganda Railway. It attained municipal status in 1923 and city status in 1935, some 28 years ahead of independence. Sir Winston Churchill, your greatest celebrated Prime Minister, intended to expand Nairobi to a bigger size than it is now, but the First and Second World Wars interfered with this. Nairobi is the capital city of Kenya and the city of national government under the leadership of His Excellency the President of the Republic of Kenya, Honorable Uhuru Muigai Kenyatta. It is home to over 100 major international companies and organizations. Nairobi is the headquarters of the United Nations, that is the UN in Africa and Middle East, the UN Environment Program, UNEP, and UN Habitat. Recently, it was declared as innovative, dynamic, and among 100 resilient cities in the world. The city has an estimated population of about 7 million. The first case of HIV in Kenya was detected in 1984. By the mid-90s, HIV was major cause of illness in Kenya. It puts huge demands on the healthcare system as well as the economy. In the last 35 years, we have made significant progress in the fight against HIV. However, Kenya has the fourth largest HIV epidemic globally, with close to 1.5 million people living with the virus. Nairobi County has the highest burden of people living with HIV in Kenya. 181,000 residents live with HIV in the city. Of this, 8,137 are children less than 14 years old. It is estimated that 7,000 new infections occurred in the city last year, with adolescents and young people contributing 45% of all new infections. Over the last 2 decades, we have been able to consistently record decreasing HIV prevalence rates in our city county. That is from 24% in 1995 to 14% in 2001 to 8% in 2013 and finally to the current rate of 6%. However, the war is still far from being won, and HIV and AIDS remain a serious public health challenge. Ladies and gentlemen, in the face of this challenge, Nairobi City County has mounted good response with support from partners. In December 2014, Nairobi joined 26 cities in signing the Paris Declaration on ending the AIDS epidemic in cities by 2030. In 2015, we developed a roadmap on how to achieve this end. In 2016, we launched the Nairobi City HIV and AIDS Strategic Plan 2015-2019 that guides the overall coordination and delivery of HIV response. It establishes strategies to address the high rate of HIV infections, especially among key populations, adolescents and pregnant women. As a city, we are targeting to achieve the 1990 UN AIDS global targets by the end of next year, 2010. As of last year, we had been able to identify 78% of all people living with HIV. We started 99% of them on treatment and achieved an overall viral suppression rate of 82%. The pediatric antiretroviral coverage is also good at 94%, making us the number 4 country in Kenya in terms of treatment coverage for children living with HIV. Nairobi is also part of a major voluntary medical male circumcision campaign, and coverage has increased from 83% in 2007 to 92% in 2012. Such gains are in line with Kenya's Vision 2030 Development Roadmap and Sustainable Development Goals. Ladies and gentlemen, I've appointed dedicated HIV program focal persons at all levels, from county, sub-county, and constituency level to implement HIV program activities. As a result, our achievements include: 1. The Nairobi TB HIV granulated report was developed in 2017 to better understand the epidemic with useful data. 2. We have increased the number of comprehensive care clinics offering treatment services from 149 in 2014 to 191 today. As 28% increased, we have also established a clinical support center to support clinicians in all these sites. 3. We developed the county midterm expenditure framework for HIV for 2018 to 2021. This guides funding from within my government and our partners. 4. We have scaled up HIV prevention activities with a specific focus on people living in the slums, and particularly among girls and young women. Condom distribution was at 16 million in 2018, 100% increase from 2016. 5. Nairobi was the first county to roll out PrEP, and so far we are offering it in 79 facilities and have enrolled 11,000 clients. 6. We rolled out HIV self-testing in 2017. 7. We now have focused HIV prevention activities targeting key populations that include female sex workers and people who inject drugs. 8. We established in 2017 a county medically assisted therapy clinic for injection drug users, which currently has 755 clients and 560 on methadone. 9. We have targeted programs to reduce mother-to-child transmission of HIV through integration of HIV treatment into maternal child health clinics. This provides one-stop shop for HIV-infected pregnant women and infants up to 2 years old and 10. We have enhanced research to support evidence-based programming. We have many more achievements, but let me conclude by assuring you that my county government, in conjunction with the national government, under the leadership of His Excellency, the President Uhuru Muigai Kenyatta, is committed to accelerate efforts to end HIV epidemic in my city. We are still pressed for resources, and we don't have enough money to carry out all these necessary programs. But we're doing the best we can. My county government takes health seriously and has allocated 32% of its budget to health. However, we still need more partnerships from the Elton John Foundation and other organizations that support health services. Indeed, the President of the Republic of Kenya, His Excellency Uhuru Muigai Kenyatta, has prioritized health under his Big Four agenda. That also includes affordable housing, food security, and industrialization. I urge all of us to unite and sustain the gains we have made. Let us innovate new ways to achieve our target of ending the AIDS epidemic by 2030. I thank you all for your attention and participation in this forum, and I wish you fruitful deliberations. Thank you very much.
Thank you very much indeed, Governor. I had the privilege over the last few weeks of coming to Nairobi myself to be able to witness firsthand much of the work being done in this area in your great city. And it was humbling to see the commitment from